Hello, everyone. Welcome. My name is Kelsey Ryan. I'm the Executive Director of AHCJ. We're going to be talking today about the Netherlands Healthcare Study Group. We're really excited about this program that we're able to do. This is the second year for a study group, which is done in support or with support from the Commonwealth Fund, which is a longtime supporter of AHCJ. We're going to do some brief introductions of myself and the other panelists, and then we'll get into some nitty-gritties about the fellowship itself, talk very briefly about the Dutch healthcare system, and also hear from one of our past fellows from another program, but who did reporting in the Netherlands to kind of give you a taste for the types of projects that we're looking for. Once again, I'm Kelsey Ryan. I'm the Executive Director of AHCJ. I'm really excited to be here. Noam, I didn't know if you would like to go next and introduce yourself.
Sure. Hi, everybody. Thanks for joining. I'm Noam Levey. I'm a senior correspondent at KFF Health News and kind of an advisor to AHCJ on these international study groups. We started last year, as Kelsey mentioned, in Germany, and very excited to help get another group of participants slash fellows ready. So good to meet all of you.
And Drew.
Hey y'all, I'm Drew Hawkins, senior reporter in the Gulf States Newsroom, and I did the AHCJ International Fellowship last spring and spent a few weeks in the Netherlands where I was looking at the Dutch approach to opioid use disorder and comparing that to the region that I cover, Louisiana, Mississippi, and Alabama. Had a really great time and learned a lot and am excited to share any insights that I might have and encourage you to apply for this amazing fellowship.
Thanks so much. All right, well, we'll move on here. Let's see, Kevin, if you could advance the slides. So yeah, who we are, hopefully you know who we are if you're on this webinar. We're part of the Association for Healthcare Journalists. We've been around almost 30 years now. Obviously, we have the membership side of the association, and then we have the Center for Excellence in Healthcare Journalism, about 1,500 members strong. We have our annual conference. We've done do a ton of training, and we do content as well on our website that helps train and educate folks on how to better cover health. And this is one of our many fellowship and training opportunities that we do, one of two international programs that we do. Next slide, please. All right, so high level on the International Healthcare Study Group, picking one country to do a deep dive on. This is the second year. Last year we were in Germany, which was our first year. And this one is going to allow US journalists need to be writing for a US audience and based in the US. But it's going to allow US journalists to see firsthand how the Dutch healthcare system works. We're going to be spending a week in the Netherlands gathering information for reports back home. And part of that experience is going to be meeting with local experts and officials, site visits, spending time learning. We'll have some cultural activities as well. It won't be 100% business. And then, of course, meals together is always a big part of being a journalist overseas. And then, help with developing your project. So people will be pitching projects for this work study, but we will also lots of stroopwafel, yes. But yes, it will be you'll get some help along the way. And a big part of our project is focusing on kind of four key areas. We're looking for projects that focus on equity, cost, coverage, or care in comparison to an aspect of the US healthcare system. Next slide, please. So this is not the Netherlands. This is from 2025. This is our German healthcare study group. This was a really great group of four journalists coming together. We spent a week together in Berlin and did tons of site visits to hospitals, met with clinicians, met with public health folks, really learned the ins and outs of this system. And you could see it was a really fun experience as well, and got to learn a lot. Next slide, please. So what all is covered in this particular program? Again, it's 1 week of training in the Netherlands. The week will be the week of November 15th. Please check your calendars if you're planning to apply. We have the week already set in stone. What we cover is travel, lodging, meals. We also, for all of our international programs, do travel insurance, which is incredibly important, as we all know, with things that happen with airlines and flights. Part of the program also will do a year's membership in AHCJ. So it could be if you're a new person coming to AHCJ or if it's your renewal. And then in addition to the programming that we do tailored sessions and have independent reporting time toward the end of the week for you to have your scheduled interviews with specific sources outside of the ones that we are able to get for you ahead of time. Next slide, please. So here's a really brief overview, high-level overview of the timeline for the program. Obviously, the applications are open. We are having the informational webinar right now. We will be doing interviews, or reviewing applications, doing interviews, and selecting finalists within the month. We will be announcing those folks in September. Anyone who is selected will then be coming back for a little bit more of a deeper dive into the Netherlands healthcare system before we go in November. That way you have a better understanding and grounding for your project and have time to think about sources and to get those secured ahead of our trip. In November, again, the week of November 15th, I put 16th on there because that's Monday, but technically we start with a Sunday night dinner with everyone. The programming will begin. We'll be following up with a whole group progress webinar in December and having ongoing touching base with the mentor throughout before the publishing deadline for projects in March. Next slide, please. Thank you. So I wanted to kind of give a brief overview too of the work study program week. So we obviously build this program around sourcing, and the goal is to help, one, give you a really good base in how their system works, but also to help with sourcing for your particular projects. So we'll, for example, have meetings set up with Ministry of Health officials, public policy experts, insurers, sometimes tech companies, academics. For this particular trip, we're looking at dementia village visits, primary care visits, potentially hospital visits as well. And of course, that really important time where you have informational debriefs with your peers and others in the group, which is really invaluable for the experience to kind of sit back and process what you've been learning throughout the day. And then toward the end of the week, you'll have time in particular for pre-scheduled interviews with your own sources based off of your story. After we get back from the trip, obviously we'll have some follow-up webinars to talk and check in with each other about progress on our work, and with the mentor, with Noam and AHCJ, with any help around your story framing with sources, any other areas you need help with. And of course, the goal, getting that good story past the finish line. We want to get that story published by March. We don't want it to be behind a paywall. We want other folks to really benefit from the reporting that you've done. There will need to be a credit line or link to the fellowship, and we'll provide the specific language for that. And of course, it needs to hit the deadline. So eligibility, again, needs to be US-based working journalists who qualify for AHCJ's professional membership. We can drop a link in the chat for what the professional membership level is. Ideally, we're looking for about 10 years plus experience. If someone has 9 years or 8 years, we're not going to say, oh, they automatically do not qualify. We know that experience is not just based on a number, but we are looking for someone who would be best set up for success in an international reporting situation. So someone who knows how to, get sources, how to organize their time, and to meet deadlines. And that's part of why we have the equivalent 10 years plus experience listed. The other really important aspect is around your passport, right? we can't help get a passport for you in time. You're going to need to have a current passport that will be valid for up to 6 months after the reporting departure date in November. Because of the rules around visiting Europe, they require that folks have passports that go well beyond the time that you're there. And that's going to be incredibly important. So part of your application process, you'll be asked to verify and to submit a photo of your passport to prove that you do in fact have a current passport that will meet these requirements. The selection process, they will be reviewed as they're submitted, rolling basis. So we really encourage folks to apply early. And then they will be scored on a matrix, which we'll get into here in detail in a second. Next slide, please. So here's the selection criteria. Next slide, please. The first part of it is your application. So this is all very important stuff for you to take notes of, please. A 500-word project proposal. We would like it to focus around some aspect of equity, cost, coverage, or care, ideally looking at a comparative aspect with the US healthcare system. And they need to be well developed, not just an initial idea, but obviously something that you've put a little bit of research into. Do you know if other people have actually written on this topic before? Are you building on other reporting that's out there? We also want to see a clear reporting plan. You know, here's the questions I will ask, and these are the people that I will talk to. And again, specific questions, sources, organizations, locations, and any relevant data sets, and how you would plan to use your time outside of the regular scheduled programming. We have the application form, which is pretty straightforward. We would like you to be able to succinctly define what your pitch is, essentially your elevator pitch or your nut graph, or your headline, however you want to look at it. We also want to know why you're applying and how this particular fellowship will help your professional development, because at the end of the day, we want to make sure that you're becoming a stronger journalist because of it. We also are looking for impact and some audience work as well. High level is fine. We just want to have a general idea of who you're writing for. And then, of course, your current resume. This is a really big one for us, a letter of recommendation, including within it a pledge to publish before March 2027 from your employer. And if you're a freelance applicant, you must submit a letter from an assigning editor at an outlet that pledges to publish or broadcast your final project by that time. This is incredibly important to underline. As part of this fellowship, we cannot help you place these articles. This is the work that we need you to do ahead of time. It's part of knowing that we have a place for all of this work to live once you've gone through the fellowship process. So please make sure that you have a letter of recommendation along with your pledge to publish as part of your application. And again, a work sample. We prefer a recent one within the past 12 months. Your best work, best foot forward. Next slide, please. Here are some tips. Noam, I don't know if you would like to talk briefly about the tips, or if you want me to to keep going. So we have some tips here for a strong proposal.
Sure. Sure, I can jump in here for a minute, Kelsey, if you want. So I want to underscore something that Kelsey mentioned at the top, that the goal of this fellowship/study group is to give you an opportunity both to report a project of your own choosing and design, and to give you some additional background and understanding of the Dutch health system while you're there. So because we're doing two things in a relatively short time period, just 1 week we'll be on the ground in the Netherlands, it really puts a premium on coming up with a project that you have pre-reported even before you submit your application, so that we're not just getting general ideas like, I want to do something about long-term care in the Netherlands, or I'm interested in the way that primary care works in the Netherlands. That you have done some reporting, you've identified a very crisp issue that you want to dig into, that you've identified sources that you want to meet, and given us a sense of how you're going to report your story. I'm going to go to this and such a primary care practice, or such and such a hospital, in order to tell this story, or I'm going to spend time with this public health agency in the Netherlands to report about opioid use, or something like that. Don't do that, because Drew did a great job on that already. But to really give a sense of how you can hit the ground running, because there's not really time to sort of get there and then think about how you're going to refine this story and how you're going to come up with it. Of course, we want you to have an opportunity when you're on the ground in the Netherlands to take a left turn if that's what you need to do while you learn something new. But again, it's really, really important to show us that you have thought a lot about this and reported a fair amount about it before we sort of put you on an airplane and tour you around the Netherlands for a week. I say all that to you not to sort of sound like a crusty old guy, but more to sort of share with you hopefully some of the wisdom that I've gleaned reporting in Europe and in other places around the world where it's just really important to do that work ahead of time, even in your application. So we can get into that more, and I'm sure Drew can share some of the insights that he's gained as well working over there. But I think it's just really important to underscore that. Kelsey, does that make sense, you think?
Totally, totally. And a big question here at the bottom of the slide: why you, why now, why this project? That's what we want to see in those proposals. Next slide, please, Kevin. I'm not going to read all of this, but if you want, this might be a really good time to take a screenshot. And essentially, this is the matrix that we use to look at proposals. So we're wanting to look at the relevance and significance of the project, the originality and approach. Is this uniquely positioned? Do you show evidence of that, pre-reporting in your process? The feasibility, does this look like it's actually achievable? Are you trying to take a bite too big that then you can chew, those kinds of things. Potential impact of what as well, how will this help inform readers? That's a big part of why we asked that audience question, which again is tied to who is your audience? Do you know who they are? Do you know who you're writing for? And is there a clear benefit or relevance to them? Of course, we're going to be looking at you, right? Your experience, your qualifications. Do you have a solid track record in journalism? Are you equipped to be successful in this program? We want to make sure that you have all the tools that you need in your toolbox for this to be a good experience and to get a lot out of it. We want to know that as a cohort, we have a good mix of folks from different backgrounds, different experiences, and different outlets or audiences. So this is a really important part for our work, is to make sure that as a cohort, we have a really good mix of folks. And then for work sample is of course important. We want to see what you've been able to do, what you've been able to accomplish, and what you're proud of. Next slide, please. All right, so yes, again, apply early. Applications are reviewed on a rolling basis, and we'll be moving quickly because November is going to be here before you know it. Next slide, please. And now I'm going to turn it over to Noam, who's going to give us a Dutch healthcare system primer.
All right. Thanks, Kelsey. And thanks again to all of you for joining. I'm not going to spend a huge amount of time on this because the fellows who are selected will have an opportunity to learn more in depth kind of about the Dutch healthcare system. But I'm hoping I can kind of whet your appetite a little bit and convince you, if you're not convinced already, that the Netherlands is a pretty good place to go to do some reporting about healthcare internationally, and most importantly, in our case, I think, serve as a really good comparator that has lessons to offer the United States. Next slide, please. So as I'm sure all of you know, the Netherlands is quite a bit smaller than the United States. It is not as wealthy as the United States. This is true for most of Europe. But the Netherlands is a wealthier country than most of even Western Europe. And again, like most other countries around the world, and even wealthy ones in Western Europe, the Netherlands spends considerably less than we do on healthcare. The Dutch healthcare system, by global standards, is actually a bit more expensive than most other countries, but again, you can see it pales in comparison to the United States. And unfortunately, for those of us who live here, it performs a lot better by measures of life expectancy, by measures of affordability, by measures of disease, and so forth. Next slide, please. Now, one of the cool things about the Dutch healthcare system, and why I think it's a really good place to go to think about lessons for the United States, is because unlike a lot of other wealthy countries around the world that have more socialized systems in which the government either owns or directly operates large parts of the healthcare system, think the UK or Canada, the Dutch healthcare system is largely similar to ours in the way it's organized. And by that I mean that you have private hospitals for the most part, private physicians, even private health insurers, or what we would consider private. But there's a big difference, and that is that the system is regulated much more aggressively than our system is. And it has put some emphasis on some places that we in our own system have sort of fallen behind. Very high rates of insurance. There is an insurance mandate in the Netherlands, so everyone has to have health insurance. It's typically provided. The patient pays a large portion of it himself or herself. Employers will contribute something too. There's also a publicly subsidized system as well. There's a very strong focus on primary care, and this is something that a lot of people study about the Netherlands. I got a chance to report in the Netherlands a few years ago and spent some time with a general practitioner in the Netherlands. And it's a very, very impressive infrastructure that was very thoughtfully designed to kind of give people access at very low cost to primary care. And that's empowered family physicians, general practitioners to really take care of patients in ways that sort of we think about as kind of a gold standard here in the US. The other thing that's really, I think, really noteworthy about the Dutch system, as we've mentioned this already a little bit in passing, is the long-term care system. The Dutch system funds a long-term care insurance program, much like the public insurance or the way we do Medicare. And the result is that you have a really well-developed system for caring for the elderly and the disabled, both in institutions, what we might call nursing homes, as well as in the community. And when we go, we'll have a chance to hopefully visit one of those places. We've had a fellow at AHCJ do a project in the past about the long-term care system in the Netherlands. That doesn't mean we can't do more. I think there's a lot to be learned there. The last thing I'll mention that's really interesting about the Netherlands is that it's a relatively new system. Only about 25 years ago, the Dutch government undertook a really radical health reform effort. And it kind of created the system as it exists today. It moved from something that looked kind of more like the British system, more sort of government heavy system, into one that interestingly incorporated some ideas from the United States about cost sharing and deductibles and managed care competition. For those of you on the call who are really into healthcare wonkery of the American kind, it was actually inspired in part by what the Clintons were trying to do in the 1990s in the US. One of the interesting results of that is that the Netherlands is one of the few places that has a deductible system. It's much, much lower than in the United States. And one of the big and most impressive things about the Dutch system, like almost everywhere in Western Europe, is that patient cost sharing is minimal, certainly by American standards. But all these things that I've just described to you are under stress, as they are in our country, as they are in most countries. Paying for healthcare with an aging population is difficult everywhere. And there is discussion about how the models that I just mentioned could be sustained going forward. But it's a really, really interesting system. It's, as Drew hopefully will tell you when he tells you about his reporting, it's inspiring in a lot of ways, even though there are places in Amsterdam and other parts of the Netherlands that face many of the same socioeconomic challenges as we do in the United States. It's fun and fascinating to kind of see the way another industrialized, wealthy country has wrestled with many of the same challenges we have without necessarily creating an entirely unrecognizable system. So I'm happy to take more questions about this as we go forward, but I can't endorse the Dutch system enough as one to study, and hope you guys will give us some great projects.
Great. Thanks so much for that high-level overview. If we can go to the next slide. Great. We wanted to give you some headlines of some specific Netherlands coverage examples for a US audience that might be useful. So if you want to Google or search for these articles, in some cases series, I think that would be really useful for folks as they're considering their applications. And then we're going to turn it over to Drew to talk about his project that he did for our other international program, but that was based in the Netherlands.
Yeah, thank you, Kelsey. Thank you, Noam. Yeah, like I mentioned at the beginning, I was really looking at opioid use disorder, but which was fascinating, by the way. And the Dutch approach is just kind of, especially from someone who grew up in the deep South, a little bit of like pearl clutching moments for myself, and then finding, that some of these strategies really work. And so it was really great for our audience to see a different alternative model like that. But as a result of just talking with so many healthcare professionals in various capacities in the Netherlands, I, learned about their system as a whole. And I was so fascinated by it because it uses private insurance, right? It's like it's very similar to ours. It's just that they have certain things that we do not have here in the US that ensure coverage. And another thing I would say, just from a reporter perspective, the amount of access that the Dutch gave me, I was like unbelievable. I mean, to go to the Netherlands, go into safe consumption rooms, meet with some of the highest officials in Amsterdam who were like, yeah, no problem. And then coming back to Mississippi and Louisiana and Alabama and being like, nobody's talking to me, right? They had data, they were open, they were welcoming. They will tell you themselves that they are not known for their Dutch food, but they have a lot of great international stuff in Amsterdam and things like that. Noam mentioned this, but I would say like the key to the success of my project is a three-part series, each looking at a different aspect and couching it in one of my states. So like Louisiana was harm reduction, Mississippi was policing and opioid use disorder, and Alabama was drug checking or drug testing, which the Dutch have like a national system that they use. Alabama, may surprise you to know, does not. So I would say the big key to success there was the pre-work that went there. I'm here on Central Time. I'm an early riser. For a few months before I went out there, I had a lot of 4 or 5 a.m. phone calls with people in the afternoon in the Netherlands, building this web of connections. People were super welcoming and they were also super helpful in connecting you to other people. So I talked to one person, they'd say, you got to talk to this person. They'd send an email connecting me, and then I'm talking to that person. And so by the time I got there, I felt like I almost kind of knew people. And they would, and that experience continued in the Netherlands. And one thing this is more on like a planning perspective, but you got to have a little bit of your normal wiggle room that you leave for yourself here at home, which is like to follow the natural leads that you come across, and people being like, hey, because it's totally different, first of all, when you're in country than it is from when you're like, I'm in New Orleans and I'm coming in a couple of weeks. Can we set an appointment, a time? And people are pretty good and nice, but it's totally different when you're like, I'm in Amsterdam. Do you have time Tuesday? And you've already connected and talked with them. But yeah, I would say like the key, opioid use disorder, opioid settlement funds was kind of the umbrella of the larger thing of my project. It was something I've been covering a lot of, right? So I was really intimately familiar with that aspect of public health policy. So this wasn't something I had to relearn on the US side. It was more of like let me incorporate a whole new experience into a foundation that I feel really comfortable with. There wasn't any really guesswork, although, it's what I saw on the ground and what I learned on the ground, I could never have known that going in. So there was, it's a combination of like things that I had planned and pre-reported, had been reporting on here a lot of, and research and reading and talking with people ahead of time and having an idea of what I might find in the Netherlands, and then going to the Netherlands and like absorbing it in real time and on location. All of those things combined were really critical elements. Yeah, I mean, I'm still in touch with some of the sources I've made there. We I there I missed Mardi Gras in New Orleans to go to the Netherlands, but apparently, and I learned this while I was there, there is a Dutch Carnival. So I went to some really small rural village in the Netherlands and went to their version of Mardi Gras and followed the story just for fun while I was out there. And everybody was super nice. I mean, they've been really helpful. Anytime anything international, especially European, anything European involving health policy, I reach out to Haas, my buddy, who picked me up in his car and drove me around. It was great. Yeah, I mean, I would say, on smaller nitty-gritty things, if you don't ride a bike, learn how to ride a bike. But yeah, it was a really, really incredible experience. I mean, the big thing for me, in addition to seeing another alternative system, is also just getting international reporting experience, which I did not have any of before, because there's so many things that you can plan for, but you can't necessarily anticipate until you actually go do that. And that was super invaluable. Like, any future international reporting endeavors that I take, which hopefully there will be many, I do have, not like, it's not like I can do anything, but I do have a breadth of experience that I didn't have before. And AHCJ was super great. I mean, all their mentors are super helpful. You will never really feel lost, but it's also that good balance of like, if you've been in a fellowship before, sometimes they can be a little overbearing, a little too many meetings. And then also there's the other version where you're like, you don't hear anything and suddenly you have a story deadline. This is a good balance of checking in, availability when you need it. We've got our WhatsApp group with my cohort at the time, because we were the only people we knew in the same time zone, and you needed that for sanity. So I feel like going there with as a collective group is going to be even better for that. And also just beautiful, beautiful, beautiful country, beautiful people, really great experience. I'm happy to talk about really any aspect of that, but I also could just ramble here for 2 hours if you wanted. So I will leave it at that. And if there's anything else that I can expand on, I'm happy to do it.
Awesome. Thank you so much, Drew. I really appreciate that on the ground experience. And with that, I think we're ready to do some questions from folks. So if you want to drop your questions in the chat, that's usually the easiest route so that we can get through things as quickly as possible. So yeah, if folks want to take time, you're welcome to ask the nitty-gritty questions about the actual what we're looking for. We have the Q&A feature, yes, down at the bottom of your screen. Sorry, not the chat, the Q&A feature. Yeah, you feel free to ask any aspect of question that you may have. Yeah, let's see. We have one question that's already come in through the Q&A down here. What city will we be in and how many days will we have for the interviews with sources? So yeah, I'm happy to answer that question, logistical. That one is, we will be based in Amsterdam. We will be doing some day trips to surrounding cities. As you know, it's not a very large country, so you can get to some of the other major areas within maybe a 45-minute train ride. But we're going to be using Amsterdam as our home base because it's really well connected. And then I lost the rest of the question. The time for sources is we'll be planning most of the programmatic experience at the beginning, the first 3 days of the program, and then leaving, Thursday, Friday more for the times that you could schedule out in advance for your interviews.
And if I could just add one little small thing to that, oh my God, the public transportation system. Wow. It's just like I stayed in Amsterdam the whole time and I was all over the country. Super intuitive, super useful. Like you can get anywhere pretty easily and pretty affordably.
Yeah, for sure. Let's see, we have another question here. We said 8 or 9 years of experience probably wouldn't rule out a good application, but what about less than that? Is it worth applying? Yes. I mean, if you've had good clips, we also know sometimes folks are doing journalism as a second career, right? And so you might not be, fresh out of school and you're applying for this with no experience under your belt. We want to see good applications, right? But we do want to make sure that folks know that we are looking for a certain level of experience. We want to know that you're going to be capable of going out, doing the reporting, getting results, and that you're not going to be, we don't want to throw you overboard, right? Without a life jacket. So we want to make sure that you're at a certain level where you feel comfortable and we think that you're going to be adequately prepared. So yes, say you have 7 years of experience, or you came to journalism as a second career or something later on, but you've been doing international reporting or something already. There are always going to be nuances to the experience level. So that's why we say we shoot for 10. but we know that not everyone has a linear career path. Let's see. Do most people in the Netherlands speak English? If not, will HCJ have translators? Yes, they speak English, and in fact, they will not want you to speak Dutch.
They speak it better than you do. I
Yeah.
guarantee it. I
Yeah.
guarantee it. I did some not Duolingo. I did the Pimsleur. I learned Spanish on the Pimsleur app, and I would like in earnest for a couple of weeks really try to learn a little bit. And every time I try to use it, they just look at me and just start speaking really good English.
Yeah, yeah. Yeah. So they will, will of course encourage folks to have Google Translate in that very rare instance. For other countries, we have had folks with fixers who, we also will sometimes make sure they have translation. So like for Japan, for example, a lot of folks for one of our other international programs had translators as part of the budget for this. We have not budgeted that for the Netherlands, given the fact that they speak English probably better than we do. So not for this particular program.
I mean, the other thing I'd add is that if you're spending time with clinicians in any context, at least this has been my experience both in the Netherlands and elsewhere, if the patients don't speak English, and that does sometimes happen even in Western Europe, I found the clinicians, I mean, universally will and have always been extremely generous in sort of acting as translators for, for whatever you may need. It would be a rare scenario, I think, where you'd have to go out and hire a translator to actually work with you. There may be a scenario where that's the case, and we could talk about that if that comes up, but in most cases that's not necessary, certainly not in the Netherlands.
Yeah. Let's see, another question here. Listening to this, a few potential projects come to mind with different clients. I'm assuming this is a freelancer. Would you prefer that applicants apply with one larger story in mind, or they can apply with two smaller ones? If they're two very different projects, I would say it's two applications. Because you're going to have to put the pitch together and the proposal and all that. You might have some of the same things like why me, why now, that part. But I would actually do two separate applications because we're going to be evaluating the proposals of the projects themselves. If they are like sort of similar stories, maybe you could package that into one. I don't know that there's a hard and fast rule here, but maybe use your best judgment in terms of the very, like how different the actual pitches are. Regardless, we would still need to have the letter of recommendation from the outlet that also has a pledge to publish.
Can I just add real quick? I mean, maybe there's a scenario in which you would envision that you could do two stories. I think it would be very hard to do it and to do a good story in the time that we have. If we had 2 weeks, that'd be different. And we didn't have any programming in which we're, going to go do site visits, maybe. But it's always better to have one really good project that you can nail rather than having something that you're aiming for that's not realistic, and then you're left with a half-reported story that's difficult to sort of land.
Yeah. Can you apply with an outlet that is behind a paywall? I know a lot of outlets do have paywalls. We do ask that because the fellowship is supporting the project, that you talk to the outlet about it being outside of the paywall. This is usually something that folks will agree to, and we found that a lot of folks are open to saying, "Oh yeah, it's a fellowship supported project. We're happy to have this one an exception outside of the paywall," or we'll have it outside of the paywall for X number of months. I mean, essentially, we just want to make sure people can read it, right? We want to make sure that it has the largest, bang for your buck, the largest ROI, largest amount of views so that it can get. And so, yes, you can apply with an outlet that's behind the paywall, but we do ask that you talk to the folks about, is there a way we can make sure that people can see it? Yeah. Let's see. Passport eligibility. Mine is currently being renewed. I have the old expiring version. I don't have the new one yet. How should I handle verification? Well, we have a couple of weeks until the absolute drop dead deadline, I would say, for applying. So hopefully you'll get it back before then. I would apply. I would put the picture of your old one, tell us you're renewing. And then, obviously the second you get the new one, take a picture and send it to us as an addendum to your application. I believe we sort of already talked about the language access. Yeah, I don't think that English will be a problem. Let's see, next question. Can you fly back after the scheduled week if you need to speak with more sources? We would not be covering any additional travel. So we essentially cover the round trip costs. So yeah, that would need to be taken care of on your own dime if you wanted to fly back. We do have sometimes folks stay longer, right? So we have had folks stay like, oh, the hotel for the week is already done on AHCJ's dime, but I have, we'll take Germany, for example. I think we had one of the fellows who had a family in like outside of Berlin or something. So they actually stayed longer or they came early. I can't remember, one of the two, where they actually visited their family. But we cover the round trip costs and the hotel for the week.
I would just quickly add to that it's pretty common, I would imagine. I know I had to do some follow-up after once I was back just to confirm things, Zoom calls to just double check stuff. So, I did get back in touch with people while I was back home.
Let's see. This one is more for a trade. Are you open to applications from news outlets with non-general audiences? I work for a publication with audience of physicians, health providers, medical societies, medical research, and policymakers. We are open to those applications. We would want you to be really clear about the audience portion of your application as well. Typically we tend to select folks from general application or general audience outlets, but I don't want to tell you not to apply. There's no hard and fast rule about not applying if you work for a trade publication or similar outlet. And we have had folks from trade publications be selected for our fellowships and programs in the past. How many have been selected? No, we just opened applications and we will be selecting 4 folks to go. And again, if you have questions, and we won't be doing the raised hand feature, please pop them in the Q&A at the bottom. Next question. Would we be able to explain the difference between this fellowship and the international fellowship? They're in different countries. Was curious about other differences between the 2 programs. Yeah, so this one is really compressed and it's within, essentially a week with follow-up. And it's a shorter timeline overall for the publication. The International Fellowship is longer and also includes attendance at our conference in the spring. So there are some other aspects of that. We will be hosting a webinar about the international and the domestic fellowships, which are sort of sister programs that run concurrently in 2027. And obviously the international one takes place, the reporting portion takes place in the spring of 2027. Also, the countries for that one next year will be the UK and France. So those are some of the high level differences in the project and the timeline and the logistics. But I'd encourage you to also come to our webinar in a couple of weeks on that other fellowship as well, where we go a little bit more in depth. Let's see here. So we answered that one. Let's see, this one asks about the Dementia Village. We're still working on the final aspects of the programming. And so it's a combination of us going ahead and putting our stakes in the ground with some folks, but then also wanting to see what projects come to us and then making sure that we have some site visits related to that. So that was just an example of a site visit we could have. Nothing is set 100% in stone yet. I don't know if you want to add anything to that, Noam, just about the site visits and how we kind of decide which ones to visit.
Yeah, we are still, as Kelsey said, putting the program together, but I wouldn't discourage you if you're interested in that dementia village or anywhere, go ahead and make your inquiries now. If we overlap, that I'm sure that won't be a problem. I'd rather have, go ahead and make some contacts, develop a plan. And if it happens that we are also going to do a site visit there, well, you'll have that much more time to do other stuff as well. I can't imagine that it would be problematic.
Yes. All right. Let's see. We have some more questions here. Will the fellows be able to travel to cities outside of Amsterdam to meet with sources? Yeah, if you have like some interviews scheduled on Thursday, the Netherlands is incredibly compact, so you could travel all over the country pretty easily by rail within, an hour or two. A lot of the country's major cities are within 45 minutes to an hour. So yeah, if you found a source really close, you would be able to easily get to them. Let's see. Can you confirm the dates? Yeah, so this, it would depend on your flight back home, of course, but we cover the week. I think the 22nd might be a quick turnaround for this person traveling, but I think you could probably pull it off if you really needed to. Let's see. Is 2 days enough time to do the on-the-ground reporting? Thinking about spending time with clinicians, patients, what if they're not available on those 2 days? So part of the idea is that again we're arranging a lot of site visits for folks the first 3 days as well. So hopefully you'd be able to use some of that as part of your reporting. And then, in advance, being able to plan, you're selected, you have basically 2 months to find folks and get things scheduled with them. So we're hoping that you would be able to find sources that are available on Thursday, Friday, or at the very least, throughout the reporting of the week, connect with someone. And then, like Drew said, be able to follow up with them afterward if you're not able to do an in-person interview later as well. I don't know if Noam, you have any other additional thoughts
I
on
mean,
that.
I would just add that we do have some flexibility. So if your project is sort of contingent on getting somewhere on, Tuesday morning, you may be able, or if there are parts of the program of site visits that are really not relevant to your project and that you could better spend your time doing some reporting on your project, I think we can be flexible. I mean, we don't want you sort of skipping part of the program to go to the Rice Museum just for kicks. But if that's something you need to do, I think we can probably talk about it. But we are reserving those latter 2 days for really intensive on the ground reporting, if at all possible.
Another question here, would you need to purchase out-of-country medical insurance in case you would need medical care while in the Netherlands? Our travel insurance that we do for all of our international programs includes a level of health insurance as well, assuming that your health insurance doesn't have international coverage. And we would provide the details of that insurance to you, of course, if you're selected ahead of time, so you can look at the policy and decide if you need to get anything else. But it's been more than enough for all of our needs so far. Let's see. How competitive is this compared to the International Fellowship? They're both competitive. So I would say, and they don't, because you apply for one doesn't mean you can't apply for others. I should always say that. We get this question from folks frequently, like, oh, I applied for the health study last year. Does that mean I can't apply for international the following year? Or I got the international one 3 years ago. Does that mean I can't apply for the health study? No, we don't have any hard and fast rule about past applicants or past recipients applying for other cross programs. Is it possible for me to apply if I'm not involved in healthcare and do not work in a news outlet? So in order to be considered one, you have to meet AHCJ's professional membership requirements, which is that you are a professional healthcare reporter. You can be a freelancer, but yeah, you need to be a professional journalist in order to apply. And this one was a question, can you talk more about the details on impact reporting the project will have? Yes, let me pull up one slide really quick. One of the things that we look at here. Yeah, potential impact. So on that project slide that we talked about earlier where I had the matrix up, we want to know, does the applicant describe the potential for the work to inform US readers and contribute meaningfully to the discourse on healthcare reform? And are qualitative and or quantitative impacts discussed? So we'd like to know if you've even been able to think through about how this kind of reporting can have an impact. And maybe you have an answer to that qualitatively or quantitatively or both. All right. If I'm an editor and spend most of my time in that capacity, my most recent byline that I'm most proud of is from a couple of years ago. Will that count against me? No. We will understand if you're mainly an editor, you haven't written directly or have a byline. That's fine. Please go ahead and apply. Do you have to be a U.S. citizen to apply? No, we would like, though, for folks to be based in the U.S. So you should be working within the U.S. and for a U.S. Audience. All right, I think we got through 25 Q&As. That's quite a bit. Of course, if you have additional questions, you can always contact AHCJ. We have put a lot of information on our website as well. I'm going to go ahead and drop the link to the main page here in our chat. So again, if you don't have the main page for the Netherlands Healthcare Study Group, the link is there in the chat. Again, we're really excited about this program. We're excited to see what the Netherlands has to offer and what information we can share back with US-based audiences. And we're excited to see the kinds of projects that folks propose. Again, if you have any questions, please let us know. At the bottom of that page, we have an email to our program manager who's happy to chat. And yeah, thank you again for coming. We really appreciate it.
Yeah, thanks everybody. And I'm going to drop my email in the chat as well. And if you're working on a project proposal and you're thinking about directions you want to go and you want to bounce something off of me, by all means, please reach out. Let me put it here. I'm happy to chat and help think through project ideas. But I hope you'll give it a good thought. It's a fun experience if you've never done it before to report on healthcare in another country, and it really deepens your understanding of the way our healthcare system works or doesn't work. So good luck.
Thanks so much, everyone.